For so many men, prostate surgery is a huge, life-saving victory. But what happens after that victory? Today, we're going to talk about a really common, but often unspoken challenge: regaining urinary control. And we'll look at the modern solutions that are really changing lives.
I mean, surviving prostate cancer it's a monumental achievement. But the journey doesn't always end right there. The reality is, life after a successful surgery can bring some new, unexpected hurdles, things that can seriously impact your quality of life.
And we're not talking about a rare side effect here. Get this, a major study found that a staggering 68% of men, that's more than 2/3, still experience some form of leakage 2 years after their surgery. So this isn't a small minority. It's a widespread challenge that deserves some real solutions.
Okay, so let's put a name to this common challenge. It's called post-prostatectomy incontinence, or you'll often hear it called PPI. And just understanding what it is, well, that's the first big step toward finding the right treatment.
So what is PPI? Essentially, it's a specific type of stress urinary incontinence. It's that really frustrating, unwanted leak that happens when you put physical stress on your body. You know, a cough, a sneeze, maybe lifting something heavy. It happens because the sphincter muscle, the one that controls urine flow, was affected by the surgery. For men where this issue doesn't get better with time or therapy, surgery is often the next step. And for decades, the field has really been dominated by two main approaches. You can think of it almost like the reigning champion versus a modern, innovative challenger.
In one corner, we have the artificial urinary sphincter, or AUS. This thing is a mechanical powerhouse that's been the go-to solution for over 30 years. And in the other corner, we have the male sling, which is a less invasive implant designed to work more naturally with your body.
So let's start with the gold standard. The AUS works by placing a pressurized cuff around the urethra, basically keeping it closed. To urinate, you have to manually operate a small pump that's placed in the scrotum. It's incredibly effective. We're talking satisfaction rates over 80%. But, and this is a big but, because it's a mechanical device, it comes with a significant rate of needing more surgeries later on. That revision rate can be anywhere from 8 to 45%, which is definitely something to consider.
Now, let's look at the challenger. The male swing works on a totally different principle. Some would even say a more elegant one. It's not about mechanically squeezing the urethra shut.
The first thing to really understand is what the sling doesn't do. Unlike the IUS, it's not designed to apply constant, high-pressure force to close off the urinary path.
Instead, the genius of the sling is all about relocation. It's designed to gently lift and reposition the urethra, moving it back to where it can function more naturally. This allows your body's own sphincter, even if it's a bit weakened, to do its job more effectively.
And this image here really illustrates the whole concept perfectly. Think of the sling as a supportive hammock. After prostate surgery, the urethra can sometimes kind of sag or drop a little. The sling simply provides a backstop, lifting it back into place and restoring a much more normal anatomical position.
Now, it's worth noting that not all slings are created equal. While the most common type, the retrourethral sling, is all about that repositioning, other designs, like the quadratic sling, add a mild degree of compression for a little extra support. Of course, this is a detail your surgeon would discuss with you based on your specific needs.
So this all brings us to the million-dollar question, right? How does a patient and their doctor actually choose between these two very different options? Well, it all comes down to a few key factors about your individual situation.
This table breaks it down beautifully. The crucial point is, the AUS is generally the better choice for severe incontinence, while the sling really shines in mild to moderate cases. The AUS is a mechanical cuff that needs a pump, the sling is a supportive hammock that lets you urinate spontaneously. And there's another huge factor here, prior radiation, which we really need to look at more closely.
The severity of the leakage is probably the single biggest factor in choosing a procedure. As you can see from this chart, the sling is highly successful for mild to moderate leakage. But for more severe incontinence, the AUS is just generally the more effective tool for the job.
And here's that other critical factor. Radiation therapy can change the body's tissues. It can make them stiffer and less flexible, a condition called fibrosis. This makes it very, very difficult for a sling to work effectively because the sling relies on that tissue being mobile. For this reason, the AUS is almost always the recommended path for patients who have had prior radiation.
But, beyond all the clinical data, there's a powerful human element at play. This quote from the research really highlights that. When all other factors are equal, most men prefer the idea of the sling. The appeal of avoiding a mechanical pump and being able to urinate spontaneously, well, that's a major consideration.
Okay, we've covered a lot of ground, so let's boil all of this down into the most important points you need to have in your back pocket when you're discussing these options with your doctor.
So here's your cheat sheet. 1. If you have severe incontinence or you've had radiation, the AUS is likely the best option. 2. For mild to moderate cases without any prior radiation, the male Sling is a very strong contender. 3. Remember the Sling works by repositioning, not squeezing, which allows for that spontaneous urination. And 4. Don't underestimate your own preference. Many men choose the Sling just to avoid a mechanical device, and that's a huge part of the discussion.
Ultimately, the goal here is to give you the knowledge and the confidence to have a really productive, open conversation with your urologist. The best path forward is always a personalized one, and now you're much better equipped to find it.
And that leaves us with a fascinating question for the future, doesn't it? You have the reliable workhorse and the simpler, more natural alternative. As technology and our understanding of anatomy keep improving, you have to wonder if the ultimate goal is to find that perfect solution, one that merges the rock-solid effectiveness of the AUS with the elegant simplicity of the Sling. Now that is something to think about.